Welcome to Fields of Study from the Masonic Cancer Center. Today we sit down with Dr. Helen Parsons, Associate Professor with the School of Public Health and a Masonic Cancer Center member. Hello and welcome to Fields of Study. My name is Max Huber. I'm the Communications and Marketing Manager with the Masonic Cancer Center at the University of Minnesota. In this video series, we sit down with some of our faculty, staff, our researchers, maybe some of our nurses, and get to know who they are, how they're adjusting to the current COVID-19 situation, and just get a little bit of background about what they're doing in the world of cancer, because that's what we do here at the Masonic Cancer Center. And I am pleased to be joined today by Dr. Helen Parsons. She is an associate professor in the Division of Health Policy and Management in the School of Public Health at the University of Minnesota. Dr. Parsons, thank you so much for joining me.
Thank you for having me.
Yeah, it's my pleasure. So you are an associate professor, Division of Health Policy and Management. You kind of have an expertise in the health policy world in cancer survivorship. What made you want to get into this field?
So, we've seen some really great strides over the last 30 years in the outcomes and survival for patients after they've been diagnosed and treated for their cancer. It's at the same time, even though we've seen these wonderful survival improvements, patients are struggling with both the physical, the emotional, as well as the financial impact very long after their cancer diagnosis. And like many of us, my family has been touched by cancer. And for me, my goal is to find ways to help improve the outcomes and the experience of patients that come after us, just so that they can have the best outcomes possible. And so that's really the goal of my research.
Yeah, and we have a very broad cancer survivorship program here at the University of Minnesota and the Masonic Cancer Center. Whether that's, and for a lot of people, it's a new thing, because back in the day, you heard you had cancer and that was it. But now we have to deal with all the situations because there are more and more people surviving from cancer. And some of that, like you said, is the mental aspect of it. It's the physical aspect. It's the reoccurrence. It's the bills. It's all these things. So it's an interesting topic. It's a growing topic. And I'd like to know, just from your perspective, whether it's healthcare interventions, whether it's informed decisions, what's the biggest thing in cancer survivorship from your research side that you're involved in right now?
Mm-hmm. So in my research, I'm working to help survivors experience the best outcomes from their cancer. And that means a wide variety of things. So it's not only helping to ensure that patients have access to the best medical care according to the best evidence that we have, but also supporting survivors with all of the other things that are happening in their life outside of their medical care to ensure that they can access the care that's needed for them, if that's related to both making sure that they have access to the emotional and social support around cancer survivorship, as well as the financial and the insurance aspects of cancer survivorship. And to do that, we use really a wide range of resources that we have available to us, everything from patient interviews to surveys, to large national cancer registry data and administrative data. And putting those all together really provides a powerful picture of what's happening to cancer survivors. And it helps us to really comprehensively look at the impact of programs and new interventions that are being tested. And so in our work, we're really working to find ways to support cancer survivors to reduce those barriers to access in medical care, whether it's helping around evaluating new insurance policies or programs that help support the whole person as a cancer survivor.
You mentioned earlier, as you were talking there, about the social aspect of this, and we've found that with the current coronavirus situation, I mean, this is throwing cancer treatments into a loop, and just even the caretaker. In a lot of these situations where people are going to get their treatment, they might not be able to go in at all, and they're getting a telemedicine visit. But if they have to go in, the caretaker or their partner, their husband, their wife, whomever it might be, might have to stay in the car. And so that is a completely different situation for cancer patients, cancer survivors. Have you seen any data around this, or just like the toll that might take on someone?
Mhm. And I feel that we're seeing from the patient perspective and the provider perspective that this is really both an opportunity and a challenge in the current situation around COVID, around thinking about how can we use this to learn and adapt our healthcare system to better meet the needs of both our patients as well as our providers, in terms of being flexible in the way that we deliver care, and understanding that some of our patients who travel to the Masonic Cancer Center are traveling, hours on a regular basis to access their care. So are there ways that we can adapt the delivery of the care and still meet the needs and help create a great patient experience for these individuals? And I think that COVID has pushed that to the forefront and forced us to really evaluate and think about what's necessary, and what are ways that we can adapt to be flexible for our patients going forward. And so I think this is going to provide a great opportunity of what is the new normal going to look like for us. And in our own research, we're looking at ways to really understand what works for both patients and providers in this new normal, so that we can provide recommendations going forward about how to operate in the future.
I think that's one of the biggest things that I've seen in this interview series is the adaptability, whether it's the nurses that I've interviewed adapting how they're doing, people just working from home. Before, if you're working in research or in cancer care, working from home wasn't really an option, but our hand has been forced. And just to see how people have changed and how people have adapted is really inspiring to me. In terms of yourself, you're not going into the office. How has this change affected you and your research?
Again, I'll just pull out the adaptability card and say, we've really had to adapt and make things work. And I think one of the things for me has just been how flexible everyone has been, and really putting in every bit of effort that they possibly can under enormous stress to be flexible, to adapt, and to really try and find the ways to make both the experience of our patients and our research teams the best possible. And I think that also has provided some great insights about, how do we work going forward, and what are ways that we can adapt the way that we previously worked to be flexible for families with small kids, and to be flexible in how we collaborate so that we can do the best work and provide the best research around cancer survivorship.
So this month was supposed to be our 15th annual Cancer Survivorship Symposium. We've, 15 years of presenting patient stories, the research that we're doing. And due to the coronavirus and COVID-19, we've had to push this off until next year. I know that you've kind of been involved in this conference before. What does it mean to not be able to have this conference and be able to see some of these patients and present this stuff? We're all just kind of thrown for a loop. We'll have an amazing event next year, but as it's Cancer Survivorship Month, I was really looking forward to this event, and now, we're not going to be able to have it.
Yeah, I think all of us are very disappointed that we weren't able to safely have this conference this year. But I think it provides us a lot of opportunities, like I said before, to be adaptable and find other ways to connect with patients in the community around cancer survivorship. And so I think right now in our group, we're looking for ways to engage with those patients, both in our research as well as our outreach activities, to make sure that they know about the resources that the Masonic Cancer Center offers them, and really with a focus towards thinking about what we're going to be able to do next year for the Survivorship Conference, and really bring those insights and the learnings that we've had from the coronavirus over the past few months around best practices and opportunities to adapt our healthcare system to really provide that best patient care for cancer survivors.
And in terms of our survivorship team here at the Masonic Cancer Center, it's a very broad group. You have doctors that are treating patients, you have people involved on the policy side like you. What's the team like, and how integral is it to have different thought perspectives come together in terms of survivorship?
Yeah, one of the things that I love about the survivorship team here is how interdisciplinary we are. And so we really bring those different perspectives around thinking about the problems and the challenges that that our patients are faced with. And so for me personally, I've in all of our research projects, have really enjoyed having those interdisciplinary teams because it not only provides good research perspectives, but also good care in thinking about the multidisciplinary provider team and how they provide survivorship care to our patients in the Masonic Cancer Center.
Got it. Going to shift gears here again. You were recently named the 2020 Order of the Eastern Star Scholar, pretty prestigious award here at the University of Minnesota and with the Masonic Cancer Center. What does it mean to you to have a group like the Minnesota Masons and the Order of the Eastern Star show their support and their funding to you?
I was very honored to be selected for this award, and I think that it is going to provide such great resources for us to continue our work in cancer survivorship in some very needed areas around support services to really help our patients get the best care that possible, not only thinking about the medical care aspect of it, but some of those social, emotional, and financial support, and thinking about how we can develop effective programs and policies to make sure patients get the care that they need.
That's great. It's an amazing organization. They've provided a lot of funds and resources to the University of Minnesota, the Masonic Cancer Center, and we're honored and glad to see you as the 2020 recipient of this. I always like to end my interviews with this question, and it's a loaded question. So it can be from a personal aspect, professional, maybe a little bit of both. But in today's environment with COVID-19, everything kind of thrown up in the air, what gives you hope?
I think that for me, I've seen so many of our providers and our research team just be adaptable and think about how do we make this work for our patients to make sure that they get the best experience possible. And so thinking about how we have completely upended the way that we deliver medical care, and everyone is pitching in to make sure that they get the best care that they need. We're rethinking our roles, the way that we do our work. And I think for me, that has provided the biggest hope for our society, that we're adaptable. We can come back from this and we can really use this as a learning opportunity to make cancer survivorship better, a better experience for our patients, for our providers going forward.
Yeah, it's a great way to put it. What was normal maybe isn't normal now, but what's normal now might not be normal in the future, where everybody's changing, adapting. And I think there's going to be some positives no matter what that comes out of this in terms of how people react, how people care for their patients, how people are viewed in the whole medical realm. So looking forward, I think we've been forced to make some changes, and I'm hopeful that moving forward, some of these stick and they stay around no matter what, even when we get back to the office and do our normal work. So, yeah, Dr. Parsons, thank you so much for joining me. This was a pleasure. You again, Dr. Helen Parsons, the 2020 Order of the Eastern Star Scholar Award recipient. Thank you so much. It's been a pleasure talking with you.
Thank you.
Join us next time on Fields of Study from the Masonic Cancer Center. We'll see you then.